I'm Erin Groff. I am an LPN here at New Perspective Senior Living, Waconia. I have been here for about 5.5 years. Some of the key attributes that I look for in a therapy provider are probably timeliness, number one, making sure that they're on time, making sure that they're making their appointments, continuity. You have the same providers in your buildings providing the cares for essentially the same residents or same people. So here with communication, if I can just use some of the communication that we have here at New Perspective with ODM, would be they call us, they let us know when changes are happening with our people. They fill out their blue sheets for the ODM Health and Wellness change mobility status. They talk to us in person. Communication is very important for residents' care, and I feel like they work very well with us here in this building. Over communication isn't really a thing, and I feel like that's kind of where we're at. I think one thing that I really enjoy seeing is we get the caseload weekly. I get that weekly to my email so that I can update the MDH roster. So I get that every Monday morning now. It was hit and miss every once in a while, but now that we've both kind of been, it was either Linda or Sarah, has always gotten a hold of me or I've gotten a hold of them, and now it's consistent where I get it Sunday night. So I don't have to worry about that. And then they do the communication through the blue sheets. I'm not sure what the actual term for them are, but we just use the term blue sheet.
Correct.
And then they're also really good about reporting if they're seeing a change in a resident while they're working with them. From our perspective here as a nurse, one of the things we hear a lot about what they could improve on would be, the communication aspect with the resident themselves. So we're hearing a lot of times that the resident's not being told that their appointment was canceled or that they were bumped. Now it's all hearsay, and we have residents here that have increased confusion that may not remember being told, if it was the day before. So kind of like a consistency schedule, but we also understand and we also tell the families things happen, therapy, therapists get sick too, they get pulled to other buildings. So there's never really a unique schedule for specifics. And I said, if there's any other further information that you need, you should talk with therapy themselves. But that's the only and biggest thing that I'm hearing.
Sure.
Is the scheduling, and why don't we have a specific schedule?
Well, my name is African. I'm the Director of Nursing here. I've been here since about January 9th of this year. The most things that I do around here is I am supervisor over the nursing department that covers admissions, people returning from the hospital, adding services to people that have declined in their health needs, like their regular ADLs. So when they have changes, I am the one who orchestrates getting the doctor's orders for those changes that they need, different services or what have you. I do attendance, scheduling. I do a lot of the meetings about the care that the residents receive and monitor the staff and make sure that they are doing the cares that they're supposed to do on a timely basis. I confirm those services at the end of the night, making sure that they're done. Anything that has been refused, I kind of look into it to see why it was refused, if something happened. Touch out to a lot of families about changes that we need. If we see things, somebody declining that is not on services, I reach out to families to let them know how their loved ones are doing. So that about covers what I do here. The key attributes that I look for is that they are taking on those patients that maybe came from the hospital, touching on doing a great evaluation to determine what their needs are. Many times you get paperwork from the facilities that they come from, like the hospital or TCU, that say what they think they need, but I think it's more forthcoming for the therapy to get in and evaluate them and to really determine what they need, because a lot of times sometimes they have needs that are not met. They have needs that are not discussed, things that are not seen. A lot of times I go to places and they say, oh, they need this or that. And then when I do an assessment myself, I see that they need more. So I think the therapy needs to be more proactive in doing those evaluations to really determine the needs of those residents that, require OT or PT. My expectations are, if there are needs that things that they require, like med lists or things like that, that they are getting those to us early, not kind of last minute, so that we know what they need and have those things available. I think they can do their job better if everything that they need is available to them and something they don't have to wait for. If you don't know what medication somebody's taking, or if they have insurance, some of the times they can't get started with therapy right away until all those things are in place. So just knowing what they need ahead of time and giving us time to get those things to them. Communication and coordination of care, I would want them to kind of let us know what they are seeing, what they kind of what they expect, and that they are also keeping us in the loop of the things that they're seeing, when they're doing the therapy, so that we are all aware and all on the same page of what's happening with the resident. We're all caring for people, and that continuity of care is pretty important to know what their needs are, what they can do, what they can't, if there's changes that need to be made, and there are services that we provide. So those things are all helpful to us, and I think the communication with them is helpful for them to know what they need to do for the resident as well.
My name is Joseph Marshall. I'm the Executive Director at the Waters of Highland Park. We have 84 senior living apartments, 54 senior living, and then 30 memory care. Therapy providers are very important, I find, in the senior living community, and often are very underutilized. So coming on board and partnering with Odom was a priority of mine, getting that therapy available. Communication is incredibly important, and I think the biggest part of that is that those the therapy team members become part of the in-house team here. That even though there's a separation, that they really see themselves as part of the team and communicate as one of the team and not just an outside entity. The pros of having the Odom team versus outside therapy teams in the building definitely are having that dedicated team here and knowing who is going to be in our building. Knowing that they're here throughout the day, so they're accessible. That makes it very easy to access them for communication purposes when families have questions, if they need to reschedule. That's a huge pro. The only con that I really see is that it's not a Medicare A certified home care. So it's those Part A folks, which again Odom has worked around to really keep that and keep those same therapists working by working with another entity, and that's been very appreciated. Coordination of care is very time-consuming sometimes, and I think one of my expectations that there is a lot of ownership there from the therapy team in setting those services up, because a lot of our residents we don't provide services for, so we really shouldn't be involved, even though they might benefit from some skilled therapy. So the Odom team coming in and owning that and checking insurances and communicating with the families and really owning that entire process has been incredibly helpful. The communication is excellent. The outcomes have been very, very good. The ownership of the process of things like getting wheelchairs for residents that need a more specialized wheelchair, the Odom team owns all of it, and everyone's been very, very pleased. I've never had one complaint. I would absolutely recommend Odom Health and Wellness to any other assisted living community. Absolutely.
I can't really say I see a downside with the outpatient structure, because from what I've seen, it's worked out. And even when people have been done with therapy, I've seen Odom pick people back up that have been done, if they see something different that they can work with them on that they hadn't worked on before, we can get that referral and they can start in that area, so sometimes they can pick up and get the person starting in a different area of care that they were, they were working on endurance, and now, they have some gait disabilities that they need help with, and, Odom can do those things. So I think that all of the Odom staff that I have came in contact since I've been here have been very professional. They are very caring about the work that they do, and they take their job very serious. And many of them, we have one that gets here pretty early in the morning and she's here pretty late. So I think that, it helps because she gets to all of the residents and she's very, available to them. And I think that's important. Well, I have one individual that I met with early on in March. They were still living at home. This person told me that they weren't able to walk, they weren't able to bathe themselves or almost anything due to Parkinson's. And they had worked with Odom Therapy, and this person is now leaving out of their apartment. They don't, using a walker by themselves, not being escorted anymore, assisting with majority of the showers. They would tell the girls or the guys, oh, I am not able to do this, I'm not able to help wash myself and things of that nature. Now they're doing majority of their shower by themselves. They do have the shakes, so a lot of the stuff like feeding, they're able to go to the dining room now and eat on their own, which they were being fed before they came here. So they had a home health aide that was coming that would kind of like feed them and things of that nature. He goes to the dining room, both meals, eats by himself, does majority of his shower, even gets up and washes his laundry. He even gets up and uses the washer. And before he came here, he was not doing any of that. So I think that is attributed to the therapy that he received through Odom and the OT and PT. So I think that was a great factor in getting him back going and still having some part of a life without just sitting in an apartment, kind of being, I said chair ridden because he only sat in a chair all the time. So I think that's a very great success story for him.
Having Odom in-house versus other home care companies or home health companies, I guess. Number one, we know the therapists, which helps. We've worked with them multiple times. A lot of times they know the residents that we're talking about without like breaking any HIPAA or anything like that. And they know how our building works. Whereas if we bring out a different company, a different home care, different therapy company, they don't know, number one, how we run. They're not necessarily very warm. The advantages of having home care is that skilled nursing part of it that we don't have the licensing for. But in all honesty, that's about it.
Okay.
It's just that skilled nursing aspect. Otherwise, we choose Odom over other home care companies if it's for therapy. I would rate Odom, honestly, at a 10, only because, or a 9.5, because there's always room for improvement. But the reason why is because I also work with them as a patient, and I've actually referred them out to people. Reasonings behind that is because there is that continuity, there is that, they're very nice, they're very welcoming here, and there's not that judgment undertone, I guess you could say, that you sometimes feel from other therapy companies. Now working with them, I had the option, or I had the chance to work with a different company yesterday, and it was only for a brief moment, and it was an outside company, and they were evaluating a resident. So I asked them, like, now this person's on the floor. You just weren't in there. Were you able to see how he was transferring? And their response to me was, well, I didn't even touch him. And I was like, okay, well, he needs a hospital bed. I was like, but that has nothing to do with his transfers.
Right.
So that interaction was very standoffish. Whereas if you were to walk up to Odom right now as an outsider, they would talk you through whatever process you need to be talked through, or they would answer any questions that you have. I would absolutely recommend Odom to another assisted living facility because of their compassion and their passion for working with the people that they work with, their personalities, their strengths, and their ability to continuously work with people and help them get stronger and they make their patients feel good about themselves.
Hey!
Hey!
Oh, please.
Megan!
No!